Welcome back to Global Health in 60 Seconds. I'm your host, Khizra Ahmad, and today I'm delighted to welcome Dr. Amel Havkic, founder and clinical leader at EvoMed Consulting. He's a hospital leader and MedTech consulting partner who has run one of the most profitable hospital units and secured millions in venture funding for MedTech companies. Wonderful to have you with us today.
Thank you so much. Pleasure is all mine.
Thank you, Amel. So we were discussing this earlier. You founded EvoMed Consulting to bridge the gap between digital innovation and clinical reality. Firstly, what inspired you, and how do you actually help MedTech companies bring clinical logic and patient safety into practical, like say, product decisions?
Inspiration and innovation comes from frustration, right? So they're very tightly connected. And in the years of clinical experience, we had to struggle so many times with non-intuitive medical solutions, MedTech solutions, as well as devices, technologies, and similar things. We were oftentimes finding workarounds to get our work done. Sometimes we had the feeling that we are actually fighting the system instead of working with it, right? And on the other hand, we saw all kinds of brilliant solutions who were ending up collecting dust because it just didn't fit the clinical workflow or clinical needs. So what we noticed, or what I noticed, is that there was basically these two worlds. On one side, the clinicians who don't feel understood, and on the other side, really good MedTech solutions who never reach the patients that they're actually intended to help. And this is actually how the idea for EvoMed was born. And how I understand EvoMed today is as a guide. You can imagine us pretty much like a Sherpa, right? If you want to scale Mount Everest, you are getting a guide, right? I mean, independent of how experienced you are, you can eventually make the climb on your own. But if you have a guide, a Sherpa, you will get there safer and faster. And this is what we're trying to do.
Well, that origin story clearly highlights your mission to ensure that innovation fits real clinical workflows. And I would love to explore that a bit further. So for over a decade, you have run one of the most profitable hospital units. I've already said that in the introduction. What management principles or strategies were key to your success? And what lessons can MedTech founders apply from hospital operations to building their own sustainable ventures?
So I am born in Bosnia, and I came to work to Germany after I finished studies because I was thinking that it doesn't matter how good I was at my job, I couldn't deliver the care. So what I started doing basically from the beginning is looking for ways, or looking for factors that make healthcare units successful. Ultimately, leading up to my MBA studies, which I did, where I launched full-scale research on that topic. And what I ended up with was pretty much a list of success factors, which are universal in healthcare, as well as in MedTech, as in clinical care. It's pretty much the same principles. It's things like specialization, cooperation and ecosystem fit, workflow alignment, improving predictability of services, but as well things like economic viability. Obviously, those business models need to pay for themselves somehow at one point, otherwise they're not sustainable. And recently, I discovered one more thing, and that is next to that hard facts, right? There's something which is basically the human factor or human connection. I think a huge part of everything working out so far is that we had, or I had, a very close relationship to the team on a human level. You have different kinds of people performing different kinds of tasks, but everyone has their human needs. And the moment that you take care of them, everything else takes care of itself. That's how I see it.
Well, that perspective on humanness in an innovation, and the human side of innovation is truly powerful. And it really sets the stage for something many founders struggle with, translating that credibility into investor confidence. And Amel, having secured significant venture funding for MedTech clients, what advice can you offer founders on aligning clinical value with commercial appeal to attract investors and also scale their innovations?
So like every good consultant, I will answer with, it depends. um, well, not really. There's, of course, it depends of a lot of factors, but there's, in MedTech, there's typically three type of founders. One is the clinical founder, typically a doctor or a nurse who has an idea and then founds a company trying to get that into the market. On the other side, you have the technical founders, the IT nerds and similar, who have a technology and then try to make an impact in the world. And I think most of us would agree that the biggest impact comes, or direct impact comes, from healthcare. So many go that route from the IT side. And then there is the founders who were previously in businesses, running businesses, being in consulting companies and similar, which I like to look at the business type of founder. Now, the healthcare system is extremely complex, and that's why you cannot succeed, and investors know this. You cannot succeed if you don't have proper performance in all of these, right? You need to be strong in the clinical side, so your problem needs to be viable. You need to be good in the operations, so on the technical side, and you need to be good on the business side, and this needs to be balanced. And I think that investors really value when a founder knows that this is the case.
You've just described really how important it is for companies to articulate both clinical impact and commercial viability. And that brings us perfectly to a framework you've built that helps innovators navigate exactly that balance you were talking about. So the EMC StarMap, it guides medtech innovators through the complexities of healthcare ecosystem. Could you explain how this framework really works? I mean, share an example of how it has helped a company navigate the red tape, regulatory, clinical, and commercial hurdles that they face.
Gladly. So the StarMap is actually unifying all of these aspects that we touched upon so far. It is pretty much navigation system, if you want, so where which manages to align the performance on each of these factors in such a way that you have the best chances of success. And we recently won an award for it. We're very proud of it at MedTech World in Malta, because and why I am particularly proud is that the StarMap is having this huge chunk of clinical viability and clinical understanding. And I see that as recognition that not only business matters in MedTech, that's actually why I'm proud about it. And one example that comes to mind, the earlier you basically use the StarMap principles, the better off you are, and the more money you will save on the long run with developing and so on. And we had recently a startup very early in the ideation stage, and what we managed is with unifying all of these aspects, really get a clear positioning of the company in comparison to other competitors. Managed to go through reimbursement hurdles and principles, all the way to understanding regulatory needs and avoiding pitfalls and traps to not land where we don't want to be. And one thing that stood out is that we identified that cooperation with a specific other provider would pretty much skyrocket the performance of that specific startup. And we managed to do all of these within one session. So we're talking 2 hours. And we can do that because we, through the StarMap, we have a very structured way of going through all of these factors. So yeah, that's pretty much what it does. It helps you orient, position yourself, and align yourself.
Well, firstly, congratulations, truly well deserved. And I was there when you got that award, so hearty congratulations once again. So, hearing how the STAR map translates complexity into clarity highlights just how valuable structured guidance can be for innovators. And one area where this becomes even more crucial is when founders start confronting clinical risk and regulatory expectations pretty early on. So, my question is, you help companies avoid, critical errors by embedding clinical logic and safety. How should founders think about risk management and regulatory compliance from the earliest stages of development?
I think you're mentioning an extremely valid and an important point because the earlier you cannot start early enough. Pretty much from the beginning, it is important, and I think it greatly depends on the solution being either clinical grade or not clinical grade. So, is it a well-being well-being solution important in its own right? Or is it something that is really treating sick people? And there's one thing that I like to give to everyone that I work with, and that is just to keep in mind that that solution has impact on human lives. And with that in mind, you pretty much have a North Star to guide you, right? So no matter what you do with your application, with your solution, it will impact human lives. And when you keep that in mind, you are more careful about things like system resilience, about failure modes, what can happen if something goes wrong. And it's not always so easy to understand if you're not in the clinical, or if you're not from the clinical field.
Absolutely. You're very right about looking at from the human side, from the human safety side, patient safety aspect of it. And with that in mind, I'd like to close with a broader question, one that looks at the future of global health and the integration of digital innovation at scale. So, keeping to the theme of global health in 60 seconds, what single change would most accelerate the integration of digital innovation with clinical practice to improve patient outcomes worldwide?
I think I have a good one for this. So, what I often hear is that startups want to be innovative and describe themselves as revolutionizing something and being really disruptive. But disruption means that something breaks. And when it comes to healthcare, disruptive innovation is not the way to go. What is much more important is to have alignment. So, the important thing about innovation in healthcare is that it aligns with the needs of all the stakeholders, being the patients with patient safety, reimbursement, economic viability, with management and operational excellence as well.
That is such a powerful closing insight and a fitting way to wrap this conversation. And exactly 60 seconds. Well done, Amil. Thank you so much for joining us and for sharing such meaningful insights with our audience today. It's been a pleasure to chat with you.
Pleasure is all mine. If you clicked on this video, chances are you're struggling with the clinical adoption of your solution, aligning with everyday workflows, and/or investor pressure. The good news, you've already started your journey to improve what's been holding you back for so long. Hi, my name is Amel Havkic, and I am the founder of EvoMed Consulting. In my years as a doctor, I've seen numerous brilliant MedTech solutions collecting dust and ultimately fail, never to help those they were intended to. I started working with MedTech companies around the globe, helping them align their solutions with clinical reality, ultimately saving them millions in losses and improving business outcomes and patient safety. Now, if anything I said so far resonates with you, feel free to book a free strategy session and let's explore how EvoMed Consulting can help your company walk you all the way from idea to real world clinical impact. The link to book your session is just somewhere below this video, and I'm looking forward to meet you and to walk this road together.